courts committee at this time. There will be another opportunity at the end. I'm hearing none. Our first item tonight added to the agenda is the Sheriff's Department would like to make a presentation.
Yes, so we have Sheriff Chapman here and Sergeant Kendall Kretschmer from Livingston County, who's the Sergeant of the Field Service Division. And they're going to talk to you about a little project they've been working on together.
Great.
We started working on this early in the spring. One of my sergeants approached me and he wanted to know my thoughts on having a SWAT team here in Shiawassee County. It's the first time in history of the Sheriff's Department we have never had our own team that can respond much more quickly. So I listened to him, and the undersheriff and I sat down with him, and we put together 4 guys that have been training with him and his team. We've completed a mutual agreement with both counties. They can be utilized anywhere in our county. One of our officers and the undersheriff will make that decision whether they'll be called out. The nice thing is we have Livingston County deputies that live in our jurisdiction, so they can be there very quickly. They have had one deployment where one of the officers from our county was the first one on scene, which was awesome, and it was in Livingston. I looked at all the training. I've been really researching everything, and it brings so much knowledge, not only to those guys that are on the unit, but to our deputies. They can learn so much from this team, which is very exciting to me. We have a lot of schools in our jurisdiction, in our county. I've always been worried. Yes, we're prepared, but now we are better prepared. So I'm very excited about this. I'll let the sergeant just tell you a little bit about their training and what they do, and we'll get out of here. Thank you.
Thank you, Sheriff.
Thank you for having me. The sheriff did a pretty good summary there on kind of how we came together. Just a little bit more background kind of on the SWAT team. And so we're a regional team made up of multiple jurisdictions. It's not just the Livingston County Sheriff's Office. I just happen to be the current commander of it. So it's Livingston County Sheriff's Office, 5 of our local jurisdictions in Livingston County, and then now the Sheriff's Office here. We're right about 24 members currently. We follow National Tactical Officers Association standards and everything that goes along with it as far as the equipment that we have, the training that we have, and then just kind of how we do stuff operationally for the team specifically. We train once a month as a whole team. Anybody that has a specialized skill set trains an additionally once every other month. And then we're required to attend 1 professional conference per year, and then we do 1 week of annual training with the whole team all together, which we actually just completed in September for 2024. Outside of that, I'm more than happy to go a little bit more in depth, or if there's any questions from any commissioners.
Can you, I'm trying to imagine rural county, what sorts of situations a SWAT team would be activated, could be activated in our county? So
that's a great question, and I don't know how familiar anybody is with Livingston, but the demographics, our population is a little bit higher. A lot of demographics are quite similar. We've got a lot of rural areas in our county. Not a whole lot of difference crossing that county line or anything. So the things the SWAT team is tasked with: hostage rescue, barricaded gunmen, high risk warrant service, dignitary protection, really anything that exceeds the capabilities of patrol. So the incident that the sheriff mentioned, in which one of the Shiawassee deputies was the first on scene in Livingston County, was actually a hostage situation. And so it was, you know, actually a very rural area, out in the middle of some cornfields and some woods, and the fella had taken his 2-year-old child, or 3-year-old child hostage after a domestic type incident, armed with some guns. So,
I'll give you an example. 7 months ago, we had a hostage situation with a gunman in a parking lot on M21 at a heavily visited retail establishment. That would have been one of the situations that they would have been needed. Because there was no one to corridor off everything, in addition to all the local police that responded. And that was just very recent.
And this is a big question, but maybe you can give me a real Reader's Digest version.
yes, sir.
What training do the deputies get that, you know, other deputies might not get or they hadn't been getting before? What sorts of things do they learn?
So a lot of it is the basic tactics are stuff that normal everyday police officers, deputies have the same knowledge. They don't get the opportunity to hone those skills as much. And then one of the big things is all the additional equipment. So better armor instead of just soft body armor, actual rifle rated plates, helmets, a couple armored vehicles, robots, cameras, and then some specialized munitions and stuff that really just increase the capability versus what a police officer or deputy going up on a scene is going to have at their disposal.
Sounds like there's no downside.
There was not any real major expense besides their time to participate.
Yeah, and that's, you know, really speaks to another, I think probably big point that's really important is, you know, it's everybody operating under mutual aid, you know, and so there's no cost recovery, nobody gets a bill, anything like that.
Sergeant, you're the commander now, you say?
Yes, sir.
Now, does the are you the permanent commander, or does that rotate around?
So, well, the permanent commander, unless I choose to resign from that position or I get removed for some reason. So we have we've got an oversight board, all of the participating police agencies. So the undersheriff here, my undersheriff, and then the chiefs from all the other police departments make up that oversight board for the SWAT team, and so they appoint the commander. So that's me now.
Okay, and you said that you just completed annual training. How long was that training?
1 week.
And to follow up on that, is the training here on site or is it off site with state police or somebody? Or?
So we run the annual training internally.
Okay.
So it was typically, in this year, it was at Camp Grayling. So they've got a lot of facilities there just to train at. And then that makeup is kind of different as far as what objectives they hit each year. And for example, this year we brought in he's a retired Navy SEAL that now has a business doing law enforcement training and stuff to give us some additional instruction for one of the days.
Okay. And then is there a limit to how many people can participate, how many sheriff deputies can participate in the SWAT team, or how do you select new people, or is it a rotational basis? Or
So there's really no ceiling as far as how many people can participate. You know, we kind of leave it up to each individual agency that participates. So as the sheriff mentioned, he's got 4 of his deputies that are on the team. My agency, we've got 8. Some of our departments have 2, 4, 6. So it's really up to what they can afford to support, not only monetarily, but as far as staffing, right? Because obviously for all of us, our priority still is to have guys out there in patrol cars to answer radio runs. So no ceiling on it, but really, we want to stay above like 18 people on the team, just as far as adhering to NQA standards, which although they're not law or anything like that, it's,
Good practice.
yeah, best practice nationally. So.
Okay. Thank you.
All right.
Most of our deputies here have done this training on their own time.
Okay.
And we chose 4 just so it would balance everything. Let's say, and a lot of them work on different shifts, so it'll work out perfect, you know. If they had a serious incident, we'd still be covered here. So, and I'm really proud of them. These guys have put a lot of time in training them. And it's hard work. It's like military boot camp. These guys got to do a physical. They got to do the whole 9 yards. So I'm really proud of them. I just wanted to update the County Board of Commissioners so you know what's going on. So we'll get out of here. Thank you very much.
Thank
He's
you.
on duty. You got to get him back to work. Thank you,
Thank you
guys.
both.
Thank you.
Hey, good to see you.
All right, that brings us to our agenda items. Item A, I would entertain a motion to approve the replacement of 2 correctional deputies not to exceed step 3.
So moved.
Support.
This is just due to 2 resignations in the jail. As you're well aware that things have changed drastically since bond reform, and it's a much more stressful job. And so we have lost 2 more. We're replacing the 2 that are budgeted.
All right. Any other questions or discussion from commissioners? All in favor of moving this forward to tomorrow night, say aye.
Aye.
Any opposed? And then item B, I would entertain a motion to approve the contract with Michigan Mental Health Court for a grant in the amount of $82,705, the Edward Byrne Memorial Justice Assistance Grant in the amount of $79,000, the Michigan Drug Court Grant Program in the amount of $54,000, and the Swift Insurers Sanctions Probation Program Grant in the amount of $55,000, and authorize the board chair to execute all necessary documents.
So moved.
Support.
Motion and support. Is there further, this is something we've done every year for quite a while now.
So these are all of the treatment courts that Judge Stewart runs over in Circuit Court. He's taken in about $1.2 million since he's begun these specialty courts. And this year they're up a little more. He's taking in about $270,000. What's nice about these from the general fund perspective is that his staff time is able to be paid for from there, so it takes off. When they're working on those projects, it removes from the general fund because they're being paid for from those grants.
Okay.
Is there something, I see some of the numbers have bounced around a little bit. What's the deciding factor as to how much?
State funding
Yeah. Okay.
allocations.
So it's nothing on our end. It's just-
I do think that at times they may request more, but it really is a dividend of a pot of money at the state level.
Okay.
Any other questions? All in favor of moving this forward to tomorrow night, please say aye.
Aye.
Any opposed? Item C, I would entertain a motion to approve the appointment of Chrissy Lab and Allison Caverson as non-attorney district court magistrates as requested by the chief judge.
So moved.
Motion and support.
So this one requires just a little more explanation. So Mike Arendine is the magistrate. He is the appointed magistrate, confirmed, or appointed by the chief judge and confirmed by this body as per statute. He does have backups, and the backups are these non-attorney magistrates. Sharon Downing was the non-attorney magistrate, and she has retired. So Chrissy Lab is now in charge of both district court and circuit court, and she's over there part of the time, but Alan Caverson is the chief deputy over district court or deputy court administrator. So they're asking that both of them be appointed as non-attorney magistrates. And the only time that they act, they have very limited abilities, is when the magistrate is unavailable or sick or not there, which happens from time to time as we have to have backup and set up.
So because these two people have other responsibilities, we're appointing 2 so they can
Correct.
back each other up
Yes.
in the event that they have to back up the magistrate.
Correct, and both of them now, if you approve them, have to go through a certification process because they're non-attorneys.
And remind me, is Chrissy Labs still friend of the court?
Yes.
Okay. So she's friend of the court and court administrator for both courts.
Correct.
Okay.
So we had one person doing it before, we have two now because the two courts are involved?
Well, because we've changed it to having one court administrator between both courts. So previously, district court had a court administrator and a deputy court administrator. Circuit court had a court administrator. Now there is one court administrator over both, but there's a deputy too. So before it was the deputy that was it.
It said in the form said there is no significant cost involved, as it was with Ms. Downing prior to, did we pay her?
There's no payment.
additional?
No, there's no additional payment. This
Okay.
is part of their job duties and responsibilities.
I wasn't sure how the way it was phrased. I thought maybe.
So it'll be the same as it was
she
with
did.
her. Okay.
Yeah, it was worth it.
Yeah, it is worded, yeah.
I did write that. There's no additional compensation given to them. It is part of their job responsibilities and duties.
Okay. Any other questions? All in favor of moving this to tomorrow night, please signify by saying aye.
Aye.
Any opposed? Item D, I entertain a motion to approve the purchase of 2 golf carts from Carts R Us in an amount not to exceed $15,100 from the Fund 260-301-970-000.
So moved.
Support.
Motion and support.
So the sheriff's posse does a certain amount of patrolling, including at the fair and at the Shiawassee Speedway, which they get paid to do these things. They used to, once upon a time, the sheriff's posse used to patrol by horse, which is obviously not what we're going to be doing any longer.
Golf
They
carts.
have, what's that?
They're gonna patrol like golf
Or
carts.
by golf carts. They have about $30,000 in that fund that they have made by doing these extra patrols, and they would like to buy 2 golf carts to do those patrols with.
So who is the posse? That's not sheriff's deputies, right?
They're not
Those are-
sheriff's deputies,
okay.
they're
They're kind of volunteers
volunteers.
who get paid, like
Yes.
they're on call.
That's right.
Okay.
And this is, after all expenses, they still have made a profit of about 30 grand this year from their patrolling, because there's been so many events at the Shiawassee Speedway, and the Shiawassee Speedway has been paying both for sheriff's deputies who do road related patrols, and then the actual posse who do the parking lot and the venue itself, and he's been paying for those services.
All right.
And is the posse set up pursuant to some enabling statute?
Correct.
That we got that covered?
Yeah, it's been around for a long time. It's set up under statute according to the sheriff's powers, duties, and responsibilities.
All right. Any further questions? All in favor of moving this to tomorrow night, please signify by saying aye.
Aye.
Any opposed? And that brings us to item E. I entertain a motion to approve the contract as presented from La Casa in an amount not to exceed $54,040 to be paid from the Child Care Fund, and authorize the board chair to execute the agreement.
So moved.
Support.
Motion and support.
So this is something that we do every year. This is the actual contractual agreement, which you have to enter into as the binding body for the county. But with that, I'll introduce Sarah Edwards, and she can talk about this and introduce her guest.
Yeah, this is Allison Morrison, who's the director of the local DHS for Shiawassee and Gratiot counties, and as hopefully everyone understands, Child Care Fund. So this encompasses our local Child Care Fund for the court as well as for the local DHS, and it's actually a contract for court-involved kids through the Department of Health and Human Services. So it's really Allison's contract, so I'll let her talk.
You can stand up, yeah. Mhm.
Okay, this is a contract we've had in place for at least, 10 years, and it is a parent support and mentor. We did expand the service this year a little bit to include in-home intervention, to allow this parent coach to go into the homes. It used to be more observable in the community and in supervised visitations in our office and in just different places, but our goal is to obviously help mentor and coach the parent in the home with the children, which makes perfect sense, right? We have to ensure safety as well as, a positive experience. And so we're hopeful that this extension will allow that relationship to build and then to facilitate reunification sooner for kids. We have reduced the number of kids in care, just for the county commissioner's information, from well over 120 at a high point in around 2010 to under 35 as of today. We're doing a lot more in-home intervention, a lot more intensive services, and this contract assists us with those kids that must be removed due to safety concerns to reunify them sooner whenever possible. So, if there's any questions.
Is it cost the same as last year?
It was $54,040, same as last year.
And I will note that that is 75% reimbursable under the child care fund, so we pay that out, but we do get 75% back. So the cost of the county is only 25% of that 54,000.
Right.
Is that up from what?
And that's up from last year from 50.
It used to be 50 to 75.
Yeah, so we are getting reimbursed for more of it. So it used to all be 50% and now it's 75%. So it's costing the same amount, but actually costing the general fund less.
It's for any in-home care components of the county child care fund.
And that is because of the governor's task force on juvenile justice reform, which I was privileged to sit on. So, yeah, 75% is it was a huge gift to counties, finally.
We also are underspent on this contract. We've had some staffing, so we're in the process of hiring. So just know it's under budget, well under budget, but we continue to feel it's valuable, so.
All right. So this applies, this is primarily for kids who would be in foster care, right? This is not for the court-involved youth, but for foster care kids. They could be both. They could be
Right.
both, yep.
It's a process.
Yep, yep.
Just to be clear, it's, the county pays it, but the county gets the 75%
Reimbursement from the
reimbursement
state.
from the state.
Yes.
It was 50, now it's 75.
Yes, I remember that because Commissioner Webster has reminded us.
Yeah, it was something that was really important for the people who were part of that. That these are things we're required by law to do, but it's one of those unfunded mandates if we don't get a reimbursement for it. So it's a much better reimbursement rate. All right, all in favor of moving this on to tomorrow night, signify by saying aye.
Aye.
Anybody opposed? All right, and this brings us to our last call to the public. Is there anybody who would like to address the Public Safety and Courts Committee at this time? If not, this meeting is adjourned, and Health and Human Services Committee will begin shortly.
Please ask you to stand for the pledge. Pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mr. Chairman, before we get started, since Commissioner Garber isn't here, I will vote in her place as the board chair.
If any members of the public would like to speak to the Health and Human Services Committee, seeing none, we'll move on. Our first agenda item, I'd entertain a motion to approve the grant agreement between Michigan Department of Health and Human Services and Shiawassee County Health Department for essential local public health services in the amount of $2,101,083 for a period of 10/1/24 through 9/30/25, and authorize the board chair to execute the contract.
So moved.
Support.
Any comments on?
So Larry, you want to go over? This is the main grant that funds a good portion of the health department's activities.
Yep, this is grant renewal of our state funding for our general public health programs that we do in the health department. So immunizations, it's WIC, it's hearing and vision, food inspections, all of our core programs.
And these are state funds, and basically today, because of today, you're gonna be able to function for next year, hopefully.
Hopefully.
Or tomorrow,
Yes,
tomorrow.
that's correct.
But this is most of your activities.
Yes, the
for
majority
year.
of my funding is state funding.
This one and the next one, both are the majority of his activities. You can set the clock by them, they come up every year at this time.
Any other questions or comments? All those in favor of moving this forward to tomorrow, say aye.
Aye.
Opposed? Hearing none, it'll be brought up tomorrow. Agenda item B, I'll call for a motion to approve the grant agreement between Michigan Department of Health and Human Services and the Shiawassee County Health Department for essential local public health services in the amount of $1,578,931 for a period of October 1, 24 through September 30, 25, and authorize the board chair to execute the contract.
I'll make the motion.
Support.
Any discussion?
School nurses.
This majority of this funding is for our school nurses. This is the third year that we've added, so we're very thankful for that.
Now, there's one in Perry and one in Durand, is that still the case?
Correct. Those nurses work for the health department. Those are separate programs in Perry and Durand, but there's also a nurse in Perry and a nurse in Durand through this separate pot of money. Those are additional nurses.
Oh, all right.
So we have 9 of them, and they're contract nurses through the RESD. So it's a real successful model that we've done. Not taking on any risk at the health department in terms of long-term costs by contracting it. So it's unique and it's worked great for the schools. Just hope it continues.
Hearing no further discussion, all those in favor of moving it forward till tomorrow, say aye.
Aye.
Opposed? It's so moved and passed. Agenda item number C, or letter C is, I'll need a motion to approve the grant agreement between Shiawassee County Health Department and the Michigan Department of Environment, Great Lakes and Energy for environmental health services in the amount of $102,685 for the period of October 1, 24 through September 30, 25. Is there a motion?
So moved.
Support.
This is part of the Clean Water Drinking Act money available to Larry and his Department of Environmental Health.
Yeah, this is for environmental health services, public water supply, campground inspections, swimming pools, and this contract is with Eagle.
And it's the normal thing that we've done year to year. This doesn't cover the septic tank business.
That's not item number 1.
I assume you also charge a fee to the people receiving those inspections.
For some of the things we do, yes.
Any other questions or discussion? Hearing none, all those in favor of moving this forward until tomorrow night, say aye.
Aye.
Opposed? And then, agenda item D, it passes. Agenda item D is, I'll take a motion to confirm the chair's appointment of Cynthia Seville to the DHHS board for a period of 3 years. Is there a motion?
So moved.
Support.
Any discussion?
Just briefly, Cynthia Seville has served on this board for 33 years. It's a 3-member board. The Board of Commissioners appoints 2 of the 3 members. The third is appointed by the state. One of their responsibilities is working and overseeing Pleasantview.
Any other comments or discussion?
I have to wonder if there's anybody else in the county who's served on a board, any board longer than Cynthia. 33 years.
Not that I'm aware of, but
And she's not done.
Right.
Or she does more.
She's wonderful. Yes, certainly.
Okay, all those in favor say aye.
Aye.
Opposed? The motion moves forward. Call to the public one more time. Seeing no one, this meeting is adjourned.